Jubilee, Dr. Mike, we're back. Let's do it.
Is decimating public health and should step down as Secretary of Health and Human Services.
Hello there,
Hello,
Mike.
hello.
Dr. Mike.
Nice to meet you.
Nice to meet you.
How do you feel about my claim?
I think your claim is absurd
Okay.
because we've got someone that is actually challenging, which is science. I mean, science is about scrutiny, not Orwellian obedience. And if we want to find the truth, we should always have both sides of the story. And
I'm curious to see how Dr. Mike approaches this. One of the big criticisms last time Dr. Mike was in a Jubilee video is he didn't really push back against the insanity. Now, he did make a follow-up video, eventually giving more context on the misinformation. But I understand the idea of really just like want to meeting people where they're at. But at some point, we got to we can't entertain nonsense. We just can't. I'm kind of done with entertaining nonsense. So, when sometimes you got to smack them around a little bit to make them listen. There's a lot of methods in terms of reinforcement teaching. Sometimes negative is good.
check out both sides and then find what the truth is.
That's interesting because in some ways I agree with your statement. We should absolutely be skeptical, and science is about proving our initial thoughts wrong. When we do research, for example, we try and look at not just our hypothesis of what we think is going to happen. We actually try to prove the null hypothesis. We actually try to design research that disagrees with us.
That means.
So I'm curious why you think Secretary Kennedy right now is the correct pick versus what you claim to be the other side.
Let's put it this way.
Well, because of vaccines. Vaccines, how dare they put vaccines into children? How dare they try to make them more healthy? See, that was the wrong way. We should have put more horse tranquilizer in kids' bodies and then test it out and see if it works. I think that's the answer.
We had to live through the medical tyranny of COVID, and his organization, Children's Health Defense, was on the front line of pushing back against that tyranny. I was part of that. I did protests.
Oh my God, I had to wear a mask. I can't believe it. They made me wear a mask and tried to sanitize my kids, vaccinate my kids. How dare they? Tyranny! How dare they? On a real note, there might be a legitimate point that is necessary to be made about whether or not certain corporations should have been so harsh and the idea of people not getting vaccinations. And there might be a legitimate argument about how the government shouldn't have suggested that COVID misinformation shouldn't spread. But then I look at this woman's face and I realize that I don't know how much that would have helped. They would have continuously spread the misinformation. Arguably, more people would have died, and they would have still complained, oh my God, vaccines. So, Crimea River. And crazy. There's a recent study that came out where it was studying a sample size of millions of people, of vaccinated and unvaccinated COVID people in one of the European countries. I don't remember if it's France or the UK. And they found that 74% of those people were less likely to get harmed or die due to COVID if they were vaccinated. So if you're vaccinated, you were 75% more likely to be safe. And this was a study of millions of people. Matter of fact, the study showed a gross percentage of people of being healthier in other causes. And I think it was 25% being of 25% more safety in dealing with cancer. So everybody who did COVID vaccines were all across the board better off than unvaccinated COVID anti-vaxxers. So, but my feelings.
On the front line of pushing back against that tyranny, I was part of that. I did protests, And I started a rally in Beverly Hills that was very popular. By the end of the year, we had 4,000 to 6,000 people marching through the streets saying, enough is enough. You know, they first, like Fauci told us, oh, you know, the masks don't work. And then, oh, you need to wear a mask. And then it was 2 masks. So again, the goalpost just kept moving and moving. And we knew it was just baloney. I mean, anybody can smell a rat. And, you know, we just see a lot of the same pattern, like during HIV, for instance. Remember that Bactrim, the NIH and the government were demonizing this with doctors. And then we find out that it actually does help HIV. But they didn't want to cure because they wanted to push AZT, which made a lot of money for Big Pharma. Same thing happened during COVID. And we had 2 doctors here in California that had a 99% success rate. Okay, it was Brian Tyson and George Fareed. And they had 7,000 patients that they helped. 99.
Fareed testified to Congress that he treated COVID patients with hydrochloroquine, zinc, and either azethic, blah, blah, blah. He said patients had great outcomes and the earlier they were treated, the better. This was never proven to be replicated in randomized controlled trials. It's crazy. She goes to this guy who's done this for thousands of people, but the millions of people who benefited from COVID vaccines, yeah, that's just fake. That's a lie. That's a lie. You know, they didn't verify this with random controlled test trials. You know what? Deep state, government's lying. But this small sample size, that's the truth. Mike, I'm tired of her talking. Speak up.
9%, which is better than the COVID-19 shot, because once we saw people taking those shots, we saw people dropping like flies.
I feel like we took a lot of topics there and we tried to put them together, so it's going to be difficult for me to reply to you.
That's why you got to interrupt these motherfuckers who just be yapping. I'm just listening. This is not, you know, you're not going to change this person's mind. You know, listening is not going to work. These people don't give a fuck what you have to say. They're just here to push agendas.
Let's start with the idea of moving the goalposts.
Okay.
So, you know, in science, we're always learning, right? As a doctor, the things that I recommend today will likely change in 10 years and 20 years, because as knowledge evolves, we're going to make new recommendations. Is that fair to say?
It's fair to say, but this is months. Okay. And we know that a virus is 0.3 micron. We see the holes in the mask. You really think that that's going to hold a virus? I mean, we see what virologists wear. It's like a spacesuit.
Yeah, so this is really interesting. I love that you point out the particle size. And you know, there's actually a unique principle with particle movements, that the reason why N95 masks actually work quite well for the COVID virus, because even when something is smaller than the size of the mask, the pores within the mask, the way that those particles move actually makes them more readily captured by that mask. Isn't that interesting how sometimes what we perceive to be the logical answer sometimes can be disproven in science? And this goes to show in the same way that we made mistakes in the past.
Well,
She's about to be like, fuck your science, fuck your math. He was like, hey, isn't it interesting how, you know, science actually proves your bullshit? That's what, let me be your interpreter, Dr. Mike. Isn't that interesting how you're wrong if you have no fucking idea what you're talking about? Because this is actually how it works. Watch her wiggle her way out of this. Oh, this is going to be juicy. Let's hear it.
The reason why I'm bringing this up is because they were putting masks on people. So now bacteria is gigantic compared to a virus. We know that, right?
Yeah, they're large.
Yo, this is troll. She's trolling me. I mean, yeah, I was wrong, but you know, virus is actually not a big deal. Yeah, I was wrong about the virus going through the mass holes. But bacteria, though, honestly, is worse. Like, come on.
My friend, by the way, was a biology research professor at UCLA. So I've learned a lot from him. And, you know, he went to a very established school, Cambridge University. And that's what he dealt with.
Yeah, like, I'm going to listen to him. I don't care about the other ones who basically debunk him and say other things that are just as qualified, arguably more qualified. But I'm going to listen to my one friend because he confirms my bullshit. Gotcha.
Well, he said, this is nonsense. So I'm going to listen to the experts, which is Dr. Elliot Hamoff, and look at people were getting
My
sick
version of the
and
X-Men.
worse when they were wearing masks because they were forcing themselves to breathe the very bacteria that was dangerous.
So when I'm in the hospital and I'm treating patients who have COVID-19, for example,
Mhm.
I wear an N95 mask. You think I'm wearing that mask to potentially make myself more sick instead of protecting myself from the patient who has COVID-19?
I believe that you believe that it works. I believe that you believe that because
No.
the medical industry, I believe, has been corrupt for a long time.
What makes it corrupt?
Of course.
There's an interest, that people have special
Big
interests.
Pharma.
It's a revolving door. When you look at a lot of these NIH or NIAID, these people.
The funny thing about these morons, right? Because I'm no longer nice to this bullshit. I'm tired of this. I'm no longer nice. I can't be. That's Dr. Mike's job. That's not my job. I bet she's a Vivek Ramaswamy supporter who literally scammed people with Big Pharma. RFK, who profited a lot from his vaccine misinformation. He's a good one, though. These people don't know what the fuck they're talking about. They're just easily manipulated.
People have been funded by Big Pharma, and then they go in the medical industry. So to me, that shows corruption.
So if someone is funded by Big Pharma, does that automatically make them corrupt?
Not necessarily, because there are honest people, but the fact that they censored, even
like RFK,
Mark Zuckerberg
right?
was asked in the Senate floor if he was being coerced by the government to shut down free speech when it came to COVID. We had a friend who her best friend died of COVID shots, 2 of them, and she had these huge boils all over her legs, and they sent her home. They did not report with VAERS that was that. They actually didn't want to even talk about it, which shows me corruption. Then I had a friend, Dr. Simone Gold, that was treating patients with early treatment, and the Master of Business Association comes to her, which doesn't have a medical license, and threatened to fire her, which she did. She got fired. That is called medical tyranny.
Okay, pause. Vote it out. Sorry.
Okay.
Please.
Dr. Mike, you let her say too much bullshit. Oh my God. This is my issue with Mike. He's too fucking nice. These people just say random bullshit. And then all you had to do is come back with facts like you did. You told her exactly how masks work. And then she just moved on to another point. She doesn't care about a conversation. She cares about what her friends say. She's a fucking idiot. Like, what are we doing at, bro? What are we doing? What are we doing here, bro? Okay, this is about to be a video. And for some reason, my videos attract some idiots in my comment section and bots. Nope, I can't be nice to her. I'm sorry.
Thank you.
Thank
Appreciate you,
Okay.
yes.
Appreciate you.
I don't. That was trash. Mike, that was trash.
Hello,
Hello, sir. How are you?
Brian.
Pleasure, Brian.
Sure.
Nice to meet you.
You're gonna let them yap the
I
entire
have
time?
a few questions to start with. Just going to want to make sure
Say
that
the
we're
same
actually
fucking
debating
narrative?
the topic that you would like
Awesome.
to debate. To say that he's decimating public health, are there specific measures that you would like to cover, to talk about, that you believe constitutes the decimation?
Yeah. So where do we start? In order
like
to
that
do
point.
good public health, in order for me to know what treatments are right for my patients, we need to do research. And currently, the NIH, the CDC budgets for research have been absolutely decimated by billions of dollars. In fact, I wrote down a few of them, if you don't mind me sharing, because I think it's valuable to talk about. So we're not talking in abstract.
Okay.
For research, we've terminated $3.8 billion into cancer, HIV, ALS, and maternal health, important subjects. The entire NIH CDC budgets have been cut in half. We've created an issue where in the Environmental Protection Agency for the Office of Research, we fired over 1,000 scientists who do that research to figure out if there's toxic pollutants that
this
cause
guy's letting
negative
you
health
talk.
outcomes.
Okay.
We've cut the CDC branch for environmental health tracking for lead and water safety. We've canceled NIH diabetes prevention program that ran for 30 years. And we've eliminated the Federal Newborn Screening Advisory Committee. So that's just a few of them.
Okay. So considering all of that,
Mhm.
before, when we had all of that money, where did that get us? Look at the state of Americans' health.
Yes. So honestly, let's remove the funding and make it worse. Based.
And you tell me that the public is actually healthy. What RFK is doing is he is saying enough is enough. Something has to change. And I will say this very politely, but I think that you have to be insane to say more is somehow going to get us out of the current public health crisis that we have right now. Americans are fat and they are sick, and it is not getting better. And taking more and more money and continuing to flush it down the toilet is not going to solve the problem. We know what will stop cancer dead in its tracks. We know what will stop all chronic disease dead in its tracks. Do you know what it is?
Lifestyle changes?
Lifestyle changes. The American Heart Association has known about this for years. The most important predictor of longevity, risk of chronic disease, all-cause mortality is VO2 max. So why aren't doctors, why isn't the government?
VO2 max is the measure of oxygen consumption during exercise. Higher oxygen levels lead to better fitness, longevity, and lower. Proven VO2 max has not been proven to stop all diseases. So just being healthier, being more fit, being more conditioned. And this guy looks like he works out. Obviously, you know, no matter how much you work out your brain, that oxygen, I mean, your body, that oxygen doesn't mean that it's going to hit to that brain. As you can tell from this ridiculous fucking point. I need Dr. Mike to speak up. I need him to shut this guy up, respond.
Creating a public health system that says, you know what, we're going to focus on VO2 max, because even if we stopped every dollar we had, putting it into cancer research right now, and we took that money and we said, let's get people moving, let's increase their VO2 max, cancer is stopped dead in its tracks. So the question is, when is enough to admit that the system you are a part of has drastically failed Americans? And RFK Jr.,
Oh
by
my
the very
God,
fact
fucking
of how
Mike,
he looks
talk.
in his 70s.
Talk. Jesus fuck. He's just listening. And I know this is okay. Here's my issue, right? Here's what's making me upset. It's not that he's not listening and like really absorbing what he's saying. It's because I know these motherfuckers in here are not going to give him the same level of good faith back and forth dialogue. They're here to spout their points. They don't give a fuck what he's about to say. That's just how it works with these people, right? Mike, you're here to debunk misinformation. You're here to make it clear what the reality of what is going on in the health world. So this is a timed event. And if you do what you did last time, where it's like you just let them yap, and then after he's done, he could just leave, and then you basically say nothing, then they're just going to spend the entire time spouting nonsense. Say something.
These does more to
Interrupt him.
encourage people to live a healthy lifestyle and truly make America healthy again.
Very passionate.
Dr. Mike is too nice. Dr. Mike is too nice, man. I love it. I love he's nice. He's a better man than me for sure. It's just frustrating. These people don't respect you. They don't. So giving them, man, go ahead.
And I mean that with all sincerity, because
I mean, I'm not trying to be an ass. Like
I don't think you are. I know you might feel like it.
He is being an ass. Yes. He said you have no idea what the fuck you're talking about. Like literally, come on. This whole fucking pretend nice thing. Let's hear the first thing he just said.
Us out of the current is enough. Look, is actually healthy. What RFK is doing is health. Where did that get us? Looking all of that before, when we had all of that money, where did that get us? Look at the state of America.
So that's just a few of them.
Okay. So considering all of that before, when we had all of that money, where did that get us? Look at the state of America, of Americans' health, and you tell me that the public is actually healthy. What RFK is doing is he is saying enough is enough. Something has to change. And I will say this very politely, but I think that you have to be insane to say more is somehow going to get us.
Maybe I'm being a little too harsh, even though he said you have to be fucking insane. But let me, I have I get a little prickly when it comes to MAGA because they're so disingenuous and cult-like. But this guy's actually been pretty respectful. Now, Dr. Mike, stop glazing and
I mean, I'm not trying to be an ass.
I think it's passion. I don't think you are. And I know you might feel like it's coming off aggressive, but I actually think it's passion. And it's passion that I share. I think lifestyle changes are incredibly important. So in order to make these meaningful changes, in order to get people to eat healthier, to exercise more, that takes research dollars in order to figure out what programs work. Like in New York, in my home state.
Do you really think it takes research dollars?
Yeah, because
It's really simple. It's sunlight, it's being active, it's having a healthy home environment, it's eating food that comes from regenerative agriculture. It's not rocket science. It is really, really simple. But I think that the pharmaceutical industry tries to
see, the moment you try to respond, he interrupted you and just started spouting nonsense. This is what I'm talking about, Mike. Stop being so fucking nice and go at them. They don't give a fuck about what you're saying.
complicate it to make people question it so that they run to their doctor. And I'll be very frank with you. I think that you have great intentions. I really do. And I'm really...
I don't give a fuck what you think, bro. Oh my God, bro. Mike is too nice. He needs to be able to deal with people, bro. He lives in a bubble of like niceness because he's a nice guy. And I love this guy. I love this guy. I love his niceness. I love his generosity. I love everything. We need more people like him, not more people like me who's a dickhead. But you're in the goblet of fire. You can't play nice with these people. You can't.
Glad that it's you sitting here, because I think part of the reason why these discussions get so heated is because both parties start thinking that the other party has bad intentions.
Sure.
I just think that you...
Then shut the fuck up and let him respond. You're just fucking talking. The moment he started talking, you just spouted bullshit again. Stop acting like you're nice. You're not nice. You don't give a fuck about any of that. I hate this pretend nice.
Are a bit confused about where we should be putting our emphasis and putting our money.
Oh,
the difficulty, I know it sounds easy to say, let's get people moving, let's get people eating healthy. So I work at a community health center. It's near impossible to change behaviors as simply as you put it. I've launched a program during my residency program where I, as a physician, exercised with my patients. I brought them in to try and see if spending time with your doctor, exercising, getting them to do it safely was a way to get them motivated. And we saw some successes, but in order to have done that, we need to scale that. We need to trial that to see ultimately how behaviors change. For example, you've seen research where people say, if you give people step counter and they walk 10,000 steps a day, they're healthier. Well, yeah, if you walk more, you move more, you're healthier. But when we actually looked at long-term research of getting people step counters, it didn't change behavior.
So you literally just contradicted yourself. And unless you're saying we need to take that money that our...
Again, he didn't see, you were quiet. He spouted, yapping. The moment you started talking, like literally 30 seconds in, he interrupts you. This is not a conversation. Not at all.
RFK Jr. is cutting from the budget and we need to spend it on the approaches that we know work, then all you're doing is just supporting the system as is.
Did he take half the budget and make it for exercise?
Well, personally, I don't think that that's the government's role. And the reason why I don't think it's the government's role is I'm going to tell you a story. And ultimately, this is what it comes.
Oh my God, Mike, stop letting this fucking... Oh, yo, Mike is about to piss me off. If he doesn't start battling it back and stop playing so fucking nice and letting these morons talk, I'm going to crash out. He's going to make me crash out. He's got to make me crash out, boy.
Comes down to, okay? I was in a halfway house in Newark, New Jersey, okay? I could leave the halfway house because I was technically still an inmate and I could go to my job, all right? If I veered from that path, I could literally go back to prison, okay? But eating healthy was so important to me that I broke the rules, went to Whole Foods and bought healthy food on an $8 an hour job that the halfway house took.
I don't give a fuck what you did. I'm gonna be honest, I don't give two shits on what you did at all. Also, why were you about to go to prison? You know what I'm saying? That's just not how most people work. This idea is, oh, I did this, so everybody else could do this. That's just a generic way of thinking how society is. As he said before, he tried to get people in the behavior. Matter of fact, he tried to work with them, which is one of the best ways to get people to work out, is create a social environment that incentivizes it and appreciates it and rewards it in some type of way. Regardless, he did that. They didn't keep up with it. They just didn't. Some people just don't when you have, oh my god, we go into like human dynamics, psychology, time efficiency. There are so many things. There are so many things to go into, like why people are acting the way they are. It's a learn. But this guy's like, well, just do better. And then when they don't do better, he's like, oh well, fuck off, go die in a ditch. That's what these people are like. They don't give a fuck about these people. If they don't rise up to his standards, he's gonna let them die in a ditch.
20%, and I still did not make excuses, and I found a way to eat
I don't
healthy.
give a fuck
Okay.
what he
Doctors, the
did.
federal government, it's never going to instill that in people. And I think that it's wrong to really place that responsibility.
I mean, people have gotten healthier and survived more from diseases because of the standards that we are talking about, right? People were able to get more fed because of the standards. People were able to live longer because of the standards. But it's such it's so ignorant to not understand how much society has changed from the time period where people were super unclean and dying. It's just ridiculous.
On you, you do not have the tools in your toolbox to effectively change behavior. And whether it's ego,
So they
I mean,
should
like,
just die
I
in
think
a
you're a
ditch.
good
What
person.
tools are we
think,
missing?
I think it's more societal and it's more
Well, you just said
cultural.
the government shouldn't be a part of it. So when you say societal, how
The
so?
president would have more power right now with the bully pulpit than any form of legislation. And that's what I'm trying to say, is that what
You're not
RFK
saying
represents
anything.
for
What the
so
fuck?
many
That's
people
random
that
as fuck.
support him, he represents a cultural shift that will have more power than any form of legislation. It's just like my political views. I do not believe in democracy. I believe in a consumerocracy. F the laws.
Mike, shut this motherfucker up. Stop letting him talk. He's just fucking spouting nonsense. Rebuttal his points, please. You're killing me, Mike. You're killing me. Rebuttal his points, please.
The politicians, f the legislation. They will fail us regardless of which party it is.
Yeah, just shout out the fucking billionaires and shout out my cult leader, my daddy, Donald Trump.
Okay, you don't have people start politicians for
Just to because
finally,
is
I
power.
think
you're
it's
gonna talk.
important. A lot of what you're saying, I want to say back to you, and you tell me if I'm seeing your point well, is that individual responsibility here is more important than societal responsibility for keeping people healthy. I respect your viewpoint. Now, this is my viewpoint, and tell me what part of this you disagree with. I think individual responsibility is incredibly important. I try and instill that in all my patients, that exercise is important. I try all different strategies to try and get them individually motivated. But from a societal perspective, let's, for example, say we make a city more walkable. We make lighting more available, especially at night. We create more sidewalks. We make more parks. We create programs for kids to participate in after-school sports programs. Those are societal things that politicians can get behind. Don't you think that will make it easier for individuals to be healthy?
All of the money that you're advocating for, and you're criticizing RFK Jr. for cutting in the budget, none of that money went to those things.
When you,
if you
diabetes
told me,
prevention, how do you think we think about diabetes prevention?
well, let me ask you this. How many people have diabetes right now? Has the number gone up since that program's been in effect for the past 30 years? So the question is, when is enough enough? The definition of insanity.
Oh my God, just keep on going. The moment these guys see heat, they just fucking pivot. Oh my. See, when Dr. Mike made a very logical, very reasonable point that society should be structured in a way to optimize certain behaviors that are good for people in general and society in general, right? Right. Like, for example, Michelle Obama trying to do the healthier food programs at schools, incentivizing more working out, incentivizing more physical activity at schools in general, like more closer cities, closer pathways so people can walk around. Like, there are so many things that, as he mentioned, that would help people be more healthy. Relooking at the foods and whether or not that, because of cost of goods, the increased amount of free time, and the ease of access of like delivery methods, should we do something to optimize healthier food items for these people who are so lazy? There are things you can do to optimize their way of life to ensure that the people are not basically going in the wrong direction. That's what a government is for, to make society better, because a government can't run without its people. That's just common sense. This guy's pivot was, oh yeah, it didn't do what I wanted to do in terms of the money. Yeah, societies helps those things, but like I don't give a fuck because it wasn't perfect. We should just take all the money away. So, let's have fuck all of those things, figure it out. That's what he's saying. Fuck all of those programs. Fuck all the ways we made people more healthy. Fuck all the ways we've brought down certain diseases. Fuck all the ways we've, created preventative measures regarding cancer. It's just such a ridiculous point of view. We went from people starving to death. We went from people dying from diseases at early life to people overeating because now we have so much food that people have the capability, but they're not really controlling what they're eating properly because they can have so much ease of access to foods. So now we have to correct that. It's like, okay, people now can eat so much, but they're not paying attention to what they're eating. There are things we could do. He doesn't give a fuck.
Is to do the same thing over and over again and expect different results.
Agreed.
It's
right.
Failed.
Is it also
has
insanity to say, since this failed, better not do anything and cut it all together?
He's not saying better not do anything.
He cut it in half.
Okay, but is he doing nothing?
Yes.
No,
Tell me what he's done
not
to
doing
encourage
nothing.
people to exercise.
Okay, what about the law in Texas that he passed with, I forget exactly what it was, but he's going around, he's essentially using what would be considered his bully pulpit, and he's trying to inspire people and make cultural changes. And ultimately,
but
that's
he can
going
be
to
an
more
inspirational
powerful.
figure and not be the head of Health and Human Services.
So it's really simple. Where has legislation gotten us? We take all of our time, all of our energy, and all of our budget, and we put it into legislation.
I agree, it's been ineffective.
And here's the deal. Whether you want to admit it or not, when you have something like pharmaceutical companies funding 70% of research.
Do you think junk food is healthy?
No.
Do you think burgers and fries are healthy?
Not at all.
Why in the first month that Secretary Kennedy was put into office, he's sitting at a Steak and Shake talking about how brave it is that they're frying the beef tallow?
Do not. Well, first of all, putting fries in beef tallow actually is not unhealthy.
But it's not about whether or not it's unhealthy. Do you think sitting at a Steak and Shake, one of the leading contributors to our obesity epidemic,
I do not agree. Was
that valuable?
I do not agree with everything that he's done. I also.
What do you agree with?
And that's what happened. Oh, I'm going to defend everything. He could cut all this stuff, get rid of all of it. Oh, what about this thing that completely contradicts everything you're fucking saying that he's done? Well, I don't agree with everything he's doing, even though it completely contradicts, I don't, but like, let's get back to why your society, these people are ridiculous, bro.
The Texas individual point.
I think that before he was getting into office, he was supporting regenerative agriculture. I think that regenerative agriculture, it has the ability to change the world. I find it comical that people drive Teslas because supposedly they're scared about global warming, and yet they eat vegetables and they have no idea that there's 550 gigatons of carbon in the air from topsoil depletion, specifically related to vegetable row crop farming. There's only 350 gigatons related to the burning of burning of carbon fuels. We could literally stop all the carbon in the air, dead in its tracks, put it back in the soil in 1 year if we switched over to regenerative agriculture. Why isn't that being talked about?
Top agricultural scientists from around the world say regenerative. This is a new term, so I haven't learned of it. I don't trust this guy's perception. I think he's just a meathead. Regenerative agriculture can significantly reduce CO2 emissions, improve soil health. However, it would not stop all carbon in the air dead in its tracks. Is this worth looking up? I may look it up. We'll see.
Because he cut $15 million from the PFAS farm program to track PFASs, which are potentially toxic chemicals, on farms. He's cutting these programs.
Once again,
the EPA is losing their research and development.
It goes back to the consumer.
But how can the consumer know about the farm?
Different choices. What do you mean? How can the consumer? Like I said, I was in a halfway house. Okay, I had
I don't
everything
give a
against
fuck.
me, and I still found a way because I believe.
But what if that Whole Foods that you went to had toxic foods in it?
Against me.
But what if
but it didn't.
Pause. I'm sorry,
Dr. Mike,
I appreciate
that was
you.
a pleasure.
Thank you.
Absolutely.
That was infuriating. Oh my goodness. He just yet this guy yap. He was just yapping and Mike was just listening and this guy was yapping. He wasn't listening. He doesn't give a fuck what you're saying. He didn't really digest what you're saying. You were listening. You're going, yeah, that's a good point. We agree here. He's like, everything you were saying, oh, I don't give a fuck. Cut all of it. Like, Mike, you're giving these people too much charity, bro.
Yep.
It was ass. It was awful.
It's a little leap.
Hello, hello.
Nice to meet you, Dr.
Pleasure.
Blake.
Nice
How
to
are
meet
you?
as well? I'm excited to be here because, you know, a lot of times when people do these debates, folks want to win. And genuinely, I want to learn from you guys and learn.
I don't want to learn from these people. What? What do we want to learn from these motherfuckers, bro? What are we learning? They say the same fucking thing over and over and over again. We know exactly what their narratives is. We get it. Like, we understand. I think the way they go about it is fucking dog awful and they're idiots. But I do think there is value to the idea of more individual exercise. There is value in looking how people are being overfed. There is a value to focus on fitness more. They don't give a fuck about any of that. They just want to cut everything. They like, come on, bro. This is not a serious conversation.
What we're doing wrong in healthcare that's impacting you. So I'm all ears.
I completely agree. It's not about winning. It's about getting to the truth. And I think we all can agree that we all want the truth. And that's why.
Let's see if you're good faith, though. Is the truth that all vaccines are killing people? Let's see if we're really about to get into the truth. Come on, let's go.
That's one of the reasons why I support RFK is because he supports transparency.
Okay.
And especially with like vaccines and healthcare and everything like that. Another thing about RFK is that he's working to get fluoride out of the water. Why do we have fluoride in the water in the first place? Is it for dental care? I think that's an individual thing. If you want strong teeth, you should probably just brush your teeth and floss. You know what I mean?
Yeah, like, why are they trying to help you have strong teeth? Like, how dare they? How dare they like help you be more healthy? The government has no right to make you more healthy. Fuck. Oh my God. What? How dare they?
Shouldn't rely on a government regulated system of our water system to give you good dental care. Like, I feel like there's ulterior.
You know why? I think what they actually should do, they should honestly remove water. Go to the fucking lake and get your own water, then boil it with some fire, and then get your own cleaning water. I don't know why the government should help you at all.
Your motives.
Are you
know what I mean?
against government programs that try and help groups of people as opposed to just individuals?
Not necessarily. It just depends on what it is.
Well, because when we say in America that the chronic health diseases in children is going up, it is. And I think I agree with everyone here on that. Statistics don't lie. But one of those chronic issues is dental disease. So if we can do something.
Can be improved by that, I think parents should stop giving their children so much sugar. Or maybe we should look at the food industry and ask why there's so much sugar in absolutely everything.
Can you walk and chew gum at the same time?
Are you going to bring up correlation?
No.
Yeah, you can walk and chew gum at the same time.
So you can do both things. Like, why can't we encourage patients and parents to not overfeed their kids added sugars
You can.
and make government programs that improve children's health?
But there's no point. Like, why would I want water with an extra ingredient if I could just have pure water? You know what I mean? Why would I need a government organization?
Well, you can buy water without fluoride.
But why should I have to buy it? I think water, obviously, nothing's free, but like water without chemicals should be free to get. If I want to drink out of my faucet, I should be able to do that without having fluoride in it, without having to worry about.
So she wants the government to provide her water. She doesn't want the government to provide her healthy water. Gotcha. Understood.
Fluoridosis or any other over fluoridation, in my body.
Mhm.
Why would I not be
And you're
privy
against
to that?
buying a filter to get rid of
I'm not
that,
against
right?
that, but why should I have to go out and buy that?
Well, because everything,
know what I mean?
everything in healthcare or public health always has a trade-off. Like, if I'm giving anyone any medication, any therapy, there's always risks and benefits. So when we think about the benefit of putting fluoride in water in order to get kids to have healthier teeth, we think about the impact on the general population. And in fact, you're right. There's been some research that shows people who have high levels of fluoride, especially children, actually this doesn't apply to adults at all, but only for children, they can have neurologic issues.
Exactly.
However, it's very important to look at the numbers and the areas that were studied, because certain areas, like in Asia, they have naturally very high levels of fluoride, not added by the government, natural occurring fluoride. And those numbers are quite high. So it really depends on what that number is and what that safe number is.
The thing about Asia is if that's naturally in the water, then people from Asia are naturally adapted to that, which means it wouldn't like
so if you
affect
moved to
them.
Asia, you would have neurologic issues?
If you said it didn't apply to adults, then maybe not. Because
I mean, as a child.
As a child, probably. If you're not from that area,
Fluoride is naturally occurring in the Earth's water supply, and its concentration of water varies greatly. Individuals seeking to limit fluoride exposure must utilize water filters or move to regions where local water levels consistently test as having very low levels. Yeah, this obsession with fluoride is just, I don't know. I don't know. I don't know. Oh, I would have to look into the comparative analysis. From my understanding, there's less evidence in terms of fluoride and its impact on neurological levels in comparison to the evidence that basically says there is no correlation at all, no causation at all. So, I don't know. It's not moving me.
your body's not adapted to that, which means if there's studies shown that people who have high levels of fluoride in their body have neurological issues, then yeah, I'm sure that they would.
Well,
but also on another note, hold on one second.
See, what? See, this mic is too freaking nice. I don't know why he granted her that, because and I know the studies that you're referring to have a very, very small sample size, from my understanding. In comparison to the opposite studies, very much indicate that there is no evidence, no strong evidence. So, or at the very least, the evidence that we're talking about. No, that was the stuff regarding Tylenol. So that's completely different.
Another note.
Continue.
Why? Because if there's fluoride in the water and fluoride in the toothpaste and chemicals in our food, there comes a point where these things start stacking up. And I would much rather have kids with cavities than kids with neurological issues.
Mm-hmm.
You know what I mean?
That's a false choice. You're not choosing kids with neurologic disease or cavities. That's not really the two choices you're making when you're making that decision.
So then what's the choice?
So I guess my question to you is, when you say chemicals, like oxygen's a chemical, water's a chemical. So how do I am trying to really get down to the core of your argument to better understand you. I'm not trying to get you in a gotcha, I promise.
Yeah.
So like, how do you decide what a chemical is? Is dihydrogen monoxide a chemical in your book?
Can you give me the short version?
Dihydrogen monoxide.
Is that oxygen?
No, that's water.
Water. Oh, water.
But like, that's what I'm saying. Like, you can make
I'm not
anything.
a chemist or anything.
But I'm not trying to trick you.
No,
The
that's
point
a
is to
compound.
I'm not clipping that up. That I'm not mad that she doesn't know that. We're gonna make her look stupid for that. Most people won't know that. Like, come on.
That's a compound.
That's a chemical.
There's a thing, but there's a difference between endogenous chemicals, things that I can make my body makes, right?
Right.
And exogenous chemicals that.
But does
come
your
from
body make
external-
water?
Does my body make fluoride?
But does your body make water?
Oh.
You need water to live.
I need water to live. Okay, but my body is 72% water, which means that I am fully made of water. Like I was
Like,
born.
we need essential amino acids. They're
I was
called-
born with water. You know what I mean? I wasn't born with fluoride in
Yeah,
my
but the
system.
water came from your parent
My what? Yeah,
From
my
your
parent,
parent.
of course. But
who
I didn't
got
get
water
any,
from the environment.
That's fine, but like,
So there's
where did the
certain
first
things we
single
need.
celled amoeba get the water from? You know what I mean? Like any living being has water, right? But not
we
everything.
need the water to survive. We need
That's
food
fine.
to
We're
survive.
not here to debate about water.
Right.
So what's your point?
My point is, how do you decide what's a bad chemical versus a good chemical?
The effects on the body.
Okay,
Right.
pause. We're out of time.
Okay.
Thank you so much. Nice seeing you.
Hey, before we go any further, we want to
I wish Dr. Mike didn't come here to try to understand these people, bro. I wish he came here to get factual information. The crazy thing, he did that in his video. Maybe he's just not a debater. Maybe that's just not. But why did he decide to do it again, though? Like,
My next surrounded claim is that the Maha movement is sabotaging the doctor-patient relationship.
Hi, doctor.
Hello,
To
pleasure.
meet you. Okay, so repeat your claim for me.
My claim is that the Maha movement is sabotaging the doctor-patient relationship.
Okay, so for me, I'm going to take this back to COVID, and I don't want to stay on this topic. I had the Delta variant.
Okay.
And I went to the doctors and I told them I'm sick, got tested positive, and my doctor told me go home until you cannot breathe.
Okay.
At the same time, we didn't have any of the
Scary advice.
Yeah, we didn't have any of the monoclonic antibodies. We weren't offered any therapies where I was listening to doctors and then watching them be censored. So I think if anything damaged the doctor-patient relationship, that was it. For me, I actually had a friend run up to my house from Huntington Beach, about a 2-hour drive, brought.
Bro, all their evidence is my friend said this. Like, it's just, I need more fake stories of my friend saying this. Maybe that'll hit. Like, it just to be fair, people are simple creatures. They resonate more with the idea of like things that they can see and resonate with them. So a friend saying something is more valuable than an expert saying something, unless that expert is someone that I choose to believe in.
Me azithromycin, hydroxychloroquine, and ivermectin. Within 48 hours, I started to recover.
Wow, it's a lot of drugs.
Yeah, but at the same time, I think that hurt the doctor-patient relationship more than anything else.
Because your doctor sent you home without treatment?
Well, that doctor and 2 telemed doctors.
I see.
All of them. No drugs, nothing to treat what I had.
Something about that?
Absolutely.
I'm saying that the MAHA movement is sabotaging the doctor-patient relationship. And you're talking about how the COVID pandemic sabotaged the doctor-patient relationship.
Correct.
You know what's wild? I agree with you. I think we sabotage the doctor-patient relationship.
Great.
So can we talk about how the MAHA movement's impacting it?
Well, I want to share with you what.
No. Yo, Dr. Mike is going to fucking make me crash out. Stop agreeing to them. They do not give a fuck about what you're saying, Mike. They don't care about your point. They just want you to agree with them. Then they're going to continue making their own fucking point, and they're not going to listen to you. They don't want to listen to you. They don't care about what you're saying. Stop giving them a olive branch, please. Oh my God, bro. This guy, I like him too much for me to hate him, but like this guy is being too nice. You can't be nice to these people, bro. It's just, oh my gosh.
What I'm going through right now, because a month ago, my husband collapsed and had a brain tumor.
I'm sorry to hear that.
It's
And it was because of the vaccines. The vaccines did it. And RFK is going to save him by working out.
Glioblastoma.
That's terrible.
And I don't want to cry.
No, why?
But
No. Take a breath.
Yeah.
Totally acceptable to cry.
Yeah, but what I'm running.
Mike is so much more nice than me. Because she would give no fucks if an immigrant family was about to die. Guarantee. So you want me to be sympathetic? Ugh, come on, bro.
Into now is they want us to do standard care, where I think as a patient, we should have the right to try. We're currently looking into Dr. Sun Xiong's trial for his bioimmunity therapy.
Okay.
He's getting treatment at Cedar, couldn't ask for better oncologists, but we cannot treat him with bioimmunity therapies until he goes through chemo and radiation, which basically, if he's not doing bioimmunity, that's going to kill both his good and bad cells. So for me, this is really personal.
Oh my God. All right, fine. Fuck it. Just don't get any health care. Go to some other country and just do some random voodoo shit. I'm gonna be honest. What's the point of this story? Oh my God. How dare the doctors try to help us with chemo? Fuck. Just don't get chemo then. Fuck it. Who cares? Who gives a fuck? Just don't get chemo. I don't give a fuck. I'm be honest.
At this point, I am looking into it, and I'm seeing the people that you want funded getting in the way of my husband's treatment, where I and my husband as a patient should have a right to try.
Correct me if I'm wrong, because I'm not an expert in oncology.
Okay.
Isn't there such thing as right to try legislation that already exists?
There is, but I don't know why. Like, for instance, it's the FDA's in the way.
But the FDA is currently run by Secretary Kennedy. So is he your
and
enemy
again,
right now?
but see, right now,
Because then we're on the same team.
Well, but at the same time, we can also go back into Biden's administration where all the money.
Oh yeah. Oh. This is. Oh, yo. She's trolling me. She's trolling me. Ain't no way she went out of her way to tell this sad story about her husband and him about to collapse, and talking about how, hey, I'm trying to try this very unique program to try to save my husband, but the FDA regulations are getting in the way. And then Mike is like, isn't RFK in charge of that right now? Shouldn't he just let you do what you got to do due to the right to try legislation? Well, but Biden though, like, yeah, he might be in charge of it, and his administration and his department's not letting me do what I want. But Biden though, you see all the terrible things Biden though, like even if my husband's life's in danger, Biden though, like these people aren't serious. They're not real people. They're not real.
Was going into changing kids' genders.
All the money?
Well, a lot of it.
No fucking way. She brought up Biden and gender. Oh my God. There's no fucking way she brought up gender affirming care out of no fucking where after talking about her husband about to die. That's crazy. No, these people are lunatics. They are crazy, crazy people. They're insane. They're mentally unwell. Oh my goodness.
A
How
lot
much
of
of
that
it?
was, well, I don't know the dollar amount, but again,
Is that
Yo, this is not a serious conversation. This is not a serious conversation. What about this one? What's this about? This I'm yo.
important?
I think that the whole industry has failed us, and I can't
agree.
even go back into who's in power. What I do like about Kennedy, if we're gonna,
I don't give a fuck. You lost all my respect. I don't give a fuck what you like about Kennedy. Let's move on. Big Pharma. Ooh, this is interesting. So the reason why I moved on from the MAHA movement is like the Make America Healthy Again movement ruining doctor-patient relationship. I mean, you know what? Let me find someone. He didn't even get to have his argument because this lady's yapping. So let's move on to someone else.
Thank you so much. I appreciate you.
I
know you're
really
going through a
appreciate
lot.
you. Thank you.
She doesn't give a fuck about all that, bro. You're too nice, man.
Pleasure.
Good to meet you.
Nice to meet you as well. So talk to me. How do you feel about the sabotaging of the doctor-patient relationship by the MAHA?
She looks like a
movement?
witch.
I don't agree with it. I don't think that MAHA is sabotaging their relationship. As a matter of fact, I think it's cultivating confidence in patients to
talks
be
like
able
a
to
witch.
speak to their doctors because it's providing education in a way that has never been there before. And I know you were talking about research. And so you're a busy doctor. Do you have time to do research?
When you say do research, do you mean actually do clinical trials myself?
Follow all of the data.
Sure.
You do. So
Yeah.
you, in addition to a week-long log of patients, you make time to read all of the material and all of the data about different
You want me to be
topics.
honest?
Yes.
Sometimes I do it in the room with the patient
Okay,
because I'm
great.
family medicine. So like a lot of different
Awesome.
conditions come. So absolutely important.
Well, you're very rare.
Well, I appreciate that, but let me ask you a question
Yeah.
so we can get off to perhaps a better talking point. Secretary Kennedy,
Yes.
in the last few months, went on a podcast and basically defamed all doctors in the United States by saying doctors are just interested in profit and keeping patients sick. Hearing that line, as a patient yourself, do you feel that your doctor is in your best interest, is working in your best interest? And do you have more trust in your doctor after hearing that line?
So I have enormous respect for Bobby Kennedy. I feel like he's
Yo, these people are cooked. They are so cooked. He asked her a very clear, direct question, and then she just went defending RFK. It's just their brains are melted. It's GG's, man. It's GG's. There's nothing you could do about that. She didn't even try to answer the question.
educated and informed and does the research on the data and has worked on cases that he's become familiarized with medical data. So I believe that when he speaks, he comes from a place of informed.
So yeah, I believe in him, even though he's not a professional, an expert, never done serious, medical research. But I believe in him because he follows MAGA, and I'm a cultist. Let's just be honest on what actually is going on right now. Yeah, the other people who's much more, endowed in the field, who has much more experience, who's knows what the fuck they're talking about. Yeah, But they're not RFK. He's my spiritual leader. Nice.
So you agree that doctors
So I'm gonna
are
answer that as well. So when I go to my doctor, typically my doctor, thank goodness, I don't have a lot of health issues, but when I have, my doctor wants to move me to medication, which always makes me think that in med school, that doctors are trained to find a medicalized solution rather than an alternative solution that empowers my own immune system and my own body.
Okay.
And so when I go in to talk to my doctor will look at me and be like, okay, you don't want any of that. And I'd be like, no, I want to have a different conversation. And MAHA provides that because it's talking about removing dyes. And I'm also a parent. So for me, there's things that involve children that I so appreciate MAHA presenting because
Holy yap. She's trying her hardest not to answer this fucking question. She is yap city right now. So the answer is yes. I don't trust doctors more. That's the answer. She just doesn't want to admit it because she doesn't want to make her RFK look bad.
before, there wasn't a choice. Doctors thought of parents and patients as kind of dumb.
I agree that 20, 30 years ago, that was absolutely the education.
Yes.
Yeah.
And it still can exist.
Yeah, because doctors are older, so that's true. I'd love for you if you can answer that question. Like by hearing Secretary Kennedy say that doctors are just interested in keeping you sick, does that improve your relationship with your doctor or not?
I would have to hear the context.
That's the context.
But I mean like the whole thing. Because one thing that I've experienced a lot with Bobby is
Yo, these people are not serious. They're not real people. They aren't real people. They aren't real people. He asked the question again and she still refuses to answer it.
that people get sound bites and they don't hear the entire interview and the entire dialogue, and then they piecemeal it and then they go, that man.
Yeah,
And-
people do that with things.
Right.
What's
So-
a way that he could have been saying that in a genuine way?
Well, in a genuine way, I think he was, I can't speak for him,
Sure.
but my experience of Bobby,
Okay. All right. This is comedy. I'm having a good laugh. I'm burning calories laughing right now.
is that he is a genuine,
This would be a
compassionate,
treatment over
kind,
medicine,
caring
laughing
human.
and watching
And he
Magda.
takes his work very seriously, and his commitment to ending chronic health disease and making sure children are healthy and adults are healthy.
Yo, Mike, ask the question again and see if she tries to. If she's gonna answer it. Answer it again.
Very,
Ask
very
it
important to
again.
him.
Ask the
So
question
if I
again.
heard that, I probably would have been like, I want to understand more about where he's coming from, because it doesn't line up for me that he would just generalize that all doctors are doing that. But in context, he might have been referring to something.
So if one of the participants here that are surrounding us came up to me after the show and said that you're a liar and everything you say is untrue, that perhaps could be said in a nice way?
Oh, well, I would probably think that maybe there's something going
Or
on.
called
for
you
that
a bad
person. I've been
Wouldn't
called
that
a
hurt?
lot of things.
But wouldn't that hurt?
Yo, this is. Yeah, it's just They can't. They're wired to never go against their cult. They just can't. It's impossible.
It would make me think for a moment, like, do you know me? Do you know what I do? Do you know how I am? Do you know my professionalism?
That's how I feel as a doctor when Secretary Kennedy says that to me. He says we're interested in people keeping people sick for profit. I don't even take a salary to work as a doctor
Right.
anymore. The YouTube stuff is so successful. I really am showing up for my patients pro bono because I want to help people. I'm here pro bono.
Right.
I flew here myself for free because I want to give you the best information. And you said
such a
Secretary
good
Kennedy
guy.
is well
He
researched.
deserves a
Yes.
world.
He
He's
goes
such a good guy.
on the podiums and he says inaccuracies all the time. And look, everyone's allowed to make mistakes. I'm not about gotchas. I'm not that
right,
guy.
right.
But when you say back in the day,
I'm not about gotchas
kids
either.
who had
But I
diabetes
do
almost
love
never
making
existed.
funny
And now
jokes.
1 in 3 kids have diabetes. It's a lie. 1 in 300 kids have diabetes. So like, how much do I as a YouTuber have to fact check Secretary Kennedy, the director of health and human services, before he comes out and says, I messed up. I need to tell you the truth and I'm getting the numbers wrong so often. When does that happen?
That's a really good point. I don't know. I guess we'd have to go back also to during COVID when they made these really outrageous statements that weren't true either. Go back because there have been mistakes, and if
I
you
have
brought that
multiple
to him,
videos on my YouTube channel, including podcasts, where we talk about every mistake we made, I made during the pandemic, because ultimately it's about trying to figure out how to do better, not to score political points.
You've been voted out.
Yeah, but they don't care.
Thank you so much. I appreciate you.
Thank
You know.
Got it. All right. Hi, nice to meet you, sir.
Pleasure. Jack?
So, yes, sir.
Okay,
Yes, sir.
I just want to make sure I got your name.
So I think to start this off, there's actually some truth to what he said. So yeah,
So
as of
who
right,
said- I said
what
or-
Kennedy said.
okay.
So the truth is that after the year 2000, doctors say that 1 in 3 children will actually develop diabetes in their lifetime. So there's actually so often a lot more truth to what Kennedy says than what you give him. And I know that
So
you're
he
not
just
trying.
said it inaccurately? You mean like, because he said, this is a quote unquote, that currently 1 in 3 children have diabetes.
I mean, it could have been that maybe the wording was wrong, but the truth is that if you were born after the year 2000, 1 in 3 people are going to develop diabetes
As a
in their
prediction.
lifetime. Yes. And so I think so often what we can do with Kennedy is we can still paint him in bad faith, even if that's not our intention. And
So he was wrong about a reality that existed. So this whole idea is like, we were painting him bad. No, he was wrong. You admit he was wrong, and now you're trying to paint him good. Okay, cool.
I think one of the things that you said actually was that Kennedy said that half of the people in China have diabetes, right? And I remember in this video you said, no, it's actually 13% of people. I'm like, total fact check. Well, the truth is that while 13% of people in China do have diabetes, the truth is that making up the rest of that 50% margin are actually people that right now already have pre-diabetes. And from 2005 to 2023, there has been a 50% increase in the number of people with diabetes in the country of China.
So what you're saying is he gets it wrong, but the intention is good?
Well, I mean, when you
Or
are
sort of right?
sorry, when you're in the public eye for years and years and years and years, there's a good shot that you're going to misword something that says,
Sure.
He missed words and gets it wrong all the fucking time. What is this coat? What is this coat? What is this coat? Do these guys like get fucked by RFK Jr., which is why they come up with the weirdest bullshit to try to defend the guy who's wrong all the time?
Did he come out and correct himself when he did that?
Well, in many cases, he has come out and correct himself. I mean, the truth is,
what cases are those?
okay, so specifically the case in Tylenol. I mean,
I can't believe Mike is actually pushing back for once. I think he's like, bro, I'm getting tired of this bullshit. I'm getting tired. And now he's like, all right, now I'm gonna start rebuttaling. I'm gonna start talking. I'm starting interrupting because they are not letting me talk. So let's do this. Thank you. This is what I wanted out of my boy Mike. This is what I wanted.
he came back and he said there is not enough scientific evidence to say that Tylenol causes autism.
So doesn't that concern you
No.
as a person who lives in the United States, that there's a press conference,
Yeah.
there's the president, Health and Human Services Secretary, the director of CMS, Dr. Oz, and they're telling you, even Dr. Makari, who runs FDA,
Right.
goes on the weeknight shows on Fox and says there's a causal relationship between Tylenol and autism. This is quote unquote, I'm not twisting words. This is what was said. And then 2 weeks later, they go, nah, never mind. Doesn't that upset you in the same way that we flip-flopped back in COVID days? I'm curious why it changes.
So here's the thing you have to understand, and I know you know this, and the truth is that science is a constant practice, it's a constant thing.
Yeah.
And so medicine specifically
Yeah, science is is a evolving thing. Except COVID, you're not allowed to be wrong. Like, come on, be real.
is also constant in itself. The thing is if something is a fact, then it will be able to be refuted, then it will stand no matter what. Whenever you come
unless
to
you learn something new, and maybe that will
which is
change
true.
the fact.
But if we have scientific facts established and they are in fact true, then they will simply stand. And that's the thing. The thing that I appreciate about Kennedy is he understands that science at the highest levels is a constant debate. And so when you see a study come out that
So you
contradicts
just
the
say
status
things
quo,
wrong.
to say that and to say, okay, Americans, we have found that, whatever could do whatever contrary to what's believed, specifically in the Tylenol system.
This guy's fucking yapping. Let's move. There's more things. I'm not going to spend all my time hearing nonsense.
Is that Big Pharma is more trustworthy than Big Supplement?
This is an interesting take.
Dr.
Hello.
Mike, how are
Love
you?
the suit.
Thank you so much.
Yep.
It's a pleasure to be with you today. I just wanted to say it's really unfortunate that you're feeling that the Maha movement is getting in the way of the relationship.
Oh, this is fucking creep behavior. The way he's talking, it's really unfortunate. It's getting in the way. Something tells me this guy has some weird interactions with women.
You're having with your patients. I think what we really need to be talking about is public trust. And the public is losing trust in our government because it is being captured by special interests like Big Pharma. And I say that because, like FDA, is funded about 50% or more from fees that are paid to it by the very drug companies that they are approving. So there's a little bit of a conflict of interest there. And also, Big Pharma spends about $20 billion a year in advertising, 7 billion of which is direct to consumer. And we see all of these ads on TV. You know the ones I'm talking about.
Absolutely, with
They're
the pretty butterflies.
They're going
people
through
in
fields and they're happy and singing songs.
Us in New Zealand, right?
Yeah. And at the end, really, really quickly, it's all about like, it could be an antidepressant medication. And at the end, it's like really, really fast, may cause explosive diarrhea, spontaneous combustion, and even suicidal thoughts. You know, Big Pharma, like any special interest, has captured our government. And when it's captured our government on so many levels, not just the 3-letter agencies, but it's out in the open how much they're giving to our electeds. And so they are literally putting the profits of Big Pharma over people and our health.
Interesting. There's parts of that I agree with and parts that I disagree with. If you'd like to hear what I agree with is that pharmaceutical companies are absolutely interested in profits. This is a for-profit system. It's a capitalist nation.
Yeah, I'm becoming super black-pilled on the idea of like how so many corporations, big pharma, corporations in general, like the big wigs of Walmart, Disney. I'm so tired of this like ultra obsession with profit, bro. It's becoming disgusting behavior. I think that the wealth inequality gap is so bad, but unfortunately we can't talk about that because, you know, people want to support a billionaire and his billionaire friends and pretend that they actually care about the people. Okay, sure.
In fact, if you look at our food supply, it's primarily focused on profits instead of trying to keep us healthy. That's pretty much always been the case within the last 50 years or so. When it comes to pharma versus supplements, which is kind of what we were discussing here, because some people say, I don't want to take a pharmaceutical, I'd rather go the natural approach. That is said a lot in terms of the internet. And I think that there's two issues with it. One is that there's this natural fallacy, that just because something is natural means it's safe, and just because something is for profit means it's evil. And that's weird to me because things that are natural can be absolutely dangerous. So like cyanide, arsenic, these are natural phenomena and they're absolutely dangerous.
Absolutely.
And things that are for profit, like supplement companies, can be sometimes beneficial. Like if someone has a vitamin D deficiency, I would absolutely tell them to take a vitamin D supplement. The issue is, do you know how big the pharmaceutical industry is in the United States for billions of dollars? You don't just say no.
How many billions of dollars they make?
Yeah.
I don't know. Off the top of my
$600
head.
billion. Crazy sum, right? Do you know how big the Global Wellness Institute says the wellness industry is in the United States?
It's probably bigger than that.
2 trillion. So why are you only interested in conflicts of interest for pharma when the supplement wellness industry is 3-4x? I'm not great at math off the cuff. So I'm just curious on that specific point.
You know, it's interesting because I don't disagree that either. I think, again, going back to my point about eroding the public trust, I think what's happening with what I know about Big Pharma is that they often.
So he's not engaging in the conversation. He's pivoting. Of course, that's what MAGA does. I will say, I didn't realize that statistic. And that really makes me think. Because there are like supplements that I'm trying to, I have creatine and I have magnesium. Those are like the only things that I'm using right now. And when I'm looking at other pills or considering other pills to try to lose weight and get fit and all that stuff, it's very interesting how many things are not certified by the FDA, or at the very least not certified to be something that's reliable. But these pills these supplements are being able to be sold. there's a lot of unreliability. Sometimes you just got to say, but trust me, bro. And I do think it's undeniably more dangerous than anything that is confirmed by the FDA. That's just 100% factual. And the fact that they're making $2 trillion with being more unreliable and playing into people's fears of big pharma, which I have issues with big pharma, trust me, is crazy. I did not know that. That makes me think. That one's a brain thing.
And have board members that sit on boards of the big
Because
media like
individuals who
Fox and
don't know
CNN,
fuck
but
all
they
about
also
science,
sit
they
on the
be trying to
board
sell
of
you
the
shit
big
all the
pharma.
time.
And so it's
How many influencers have tried to sold you some bullshit and you just trust them? Come on now.
that we're worried about, because those things are really causing more complications. Like, you're taking one big pharmaceutical pill and it's causing 5 other problems, and it becomes a sick care system. I can elect to take those other non-FDA approved drugs, and I'm choosing that, but I'm being told by my doctors, who are also, being pushed by big pharma to push these options on us. So it's more of a choice for.
Are they forcing you to take those medications?
I mean, when you go to a doctor and you're trying to figure out, and you're constantly being bamboozled by, you should take this and that and a third, you feel like that's your only option, because we're kind of being programmed that we have to go in that direction.
What happens when you walk into a pharmacy and you walk down the vitamin aisle? What are the words that you see thrown at you?
Oh, like help sleeping, or
health,
energy,
energy.
Sure.
What proof do they have to submit in order to sell their supplements?
I would guess nothing.
Me and you right now can take whatever supplement we want.
Yeah, it's our choice.
Bottle it up right here. No. Bottle it up right here.
Right.
On this table.
And market
in
it.
capsules. Market it. Put it in a pharmacy if it sells well, especially if you have lots of followers, and make millions of dollars.
Sure, you could, but it's still my personal choice as a consumer, and I think it goes back to.
And it's still your personal choice to take pharmaceuticals. No one's forcing you to take pharmaceuticals.
It's actually insane how brainwashed these people are. They're more than willing to say, oh, it's my choice to take these supplements and make without any evidence to make these individuals millionaires. But something that has scientific backing, that has levels of checks and procedures of an organization that makes way less money, well, those people, I have to take them. I just don't get the logic here. It's just MAGA. I think this is something that I want to get very clearly across to MAGA. You people are so brainwashed. You guys are creating more billionaires. You guys are creating more millionaires. You guys are feeding into the elites that you guys claim is a problem. I want to get rid of the elites from big pharma and the wellness industry. Y'all are just making certain types of people rich. You guys are going from this place saying all of you guys are bad, just making all these other people rich. And the thing is, a lot of these billionaires that are profiting off of you making them rich, you know what they're doing? What they're doing is that they're just grifting to Trump and the MAGA movement and just pocketing all the money from the MAGA cultists. You're playing right into their hands. That's why all these fucking billionaires are starting to become buddy-buddy with Donald Trump, because you follow Donald Trump, then you're just going to buy all their products. It's crazy. It's crazy.
Yes, absolutely, that's true.
But pharmaceuticals at least have to submit something to prove that they work, that they have some safety profile. But what me and you created today, no one has to prove anything. And they also have had instances where they've led people to have liver failure, death. They've been sued by the FDA. There's been threatening letters. Consumer Labs goes and tests what's in these supplements and finds out what's on the labels not actually in the pill. Why don't you have an interest in that?
Well, I don't think the doctors are pushing that. If I go to my doctor, they're not pushing all those supplements and everything like that.
Yeah, the influencers are. Don't you think that's a bigger problem when it's 2 trillion versus?
Let's be very clear. Influencers are way more impactful and have way much more influence than fucking doctors, and that's not even a question. So to say, oh, my doctor's not... People are getting brainwashed by influencers. And I mean that all across the board. I have a big issue in influential culture and streaming culture. Like I
600
really
billion?
Okay, pause. You've been voted out. Oh, people
Thank
are
you
getting
so much.
brainwashed.
Appreciate it.
And these people are not taking any accountability for it.
Hello, pleasure.
I'm Heidi.
Nice to meet you, Heidi.
Nice to meet you too. So we're talking supplements.
Supplements versus pharma. What do you got?
Okay. What I heard in the last debate is that you feel like doctors don't have the responsibility to teach their patients about the supplements. Like if I went to the doctor and I said, hey, I heard that magnesium can really help me with cramps,
Okay.
And the doctor would educate me on that, right? Especially if I asked a question.
Sure.
But if I
absolutely
went
should.
into the doctor and said, listen, I am suffering from these leg cramps that are excruciating. I am screaming into the air at night and my neighbors are scared of me.
Mhm. From like a
What
restless leg
can I
syndrome
do?
situation.
Well, I have both,
Okay.
but what do I do? What's your first go-to? Are you going to go towards the pharmaceutical in it, or are you going to hit, well, maybe magnesium can help you, which it has, by
I
the way.
will present the correct diagnosis pathway to, first of all, make sure that is the condition that you have.
Right.
Because a lot of times the internet guides patients to believe that they have certain conditions that they don't.
Well, cramps are pretty self-explanatory.
Meaning not the symptom.
Right.
Your symptom is your symptom. I'm no
Right.
expert in that. It's your
Gotcha.
body.
Yeah.
So the symptom is real. The question is, what is the diagnosis that's leading for that symptom to
Right.
happen?
Right.
Because some functional medicine doctors tend to take this approach where they say, we look at the root cause where your doctor doesn't. Well, I don't know. I was trained in medical school to always look for the root cause and not just put a bandage on things because I actually want to help you. So I wouldn't necessarily look to treating your symptom instantly. I would first start an investigative path to figure out why you have said symptom. For restless leg syndrome, one of these lab values that's oftentimes not checked that correlates with restless leg syndrome is anemia. And sometimes supplementing iron in those patients who are anemic could be beneficial for them.
Right.
And guess what? That's an absolute supplement that can help in those situations. But better yet, here's what a good doctor should do. A good doctor should present the options if there's a pharmaceutical one, if there's a natural one.
I agree.
And ask which one resonates with you.
Well, then why are doctors and big supplement fighting with each other? Why are they against each other?
I'll
Why
tell you.
shouldn't they work?
That's a good
shouldn't they
question.
work?
Oh, she's actually asking good faith questions. She's actually engaging in conversation. Oh my God, I can't believe it. It's happening. Good faith conversation. I agree to that. I mean, I don't just blindly believe in doctors. I don't really go to the doctor very often. I recently just got health insurance. I usually never need to go to the doctor. But I think I'm growing older. I can kick the bucket anytime. I think it's at this point I should get health insurance. So I did. My thing is, there might be natural ways. Sometimes medicine can help alleviate problems quickly. Sometimes you just let your body do its work because that's what a body's functioning for. I think that's fine. And the doctor should provide all the different type of scenarios, not just to make a profit from someone buying a bunch of medicine and drugs. I hate that. Like, we can have a good faith conversation about the
Together?
They absolutely should.
inefficiencies
Yeah.
behind
Here's what happens.
how
If
doctors
certain
proceed.
supplements start
But then we can't make the argument that all the fucking influencers who are trying to force you to buy supplements are doing things in good faith either.
becoming very well proven in research that they work, they just become regular medicine and we don't even think about them as supplements. Like if
Right.
someone has a vitamin D deficiency or an iron deficiency,
Right.
no one thinks about a doctor prescribing iron or vitamin D, but we do that.
Right.
In fact, there are some rare indications where we use prescription grade omega-3 medications called Lavazza. So we absolutely do prescribe those. Why we go to war with the supplement company, especially me and my YouTube channel, is because I feel when our healthcare system screws you over and you're hurt because you were misdiagnosed, not listened to, written off, which I'm sure happens,
Which happens.
they go to you and they pretend like they care to sell you something that is potentially unproven
Well, don't
or
doctors do the
exaggerated.
same thing? Do you just automatically assume all?
But you're not listening. The point of him saying that is not to say doctors are just doing the best job. The point of him saying that is, I call out when doctors don't do their job correctly. I call out when doctors are focusing on their own profit versus caring about the patient. I also call out the influencers too. And it's more dangerous because they are trying to provide themselves as a solution to all your problems without any scientific basing. So they're providing unproven methods to help you, which could worsen your health or not help you at all, to make themselves more rich. So I don't get the. I really think they genuinely think. No, I know for a fact they genuinely think that all doctors are just corrupt, and then influencers that are right wing are okay. It's just like, come on, bro. That's just not how the world works.
All doctors care because not all, some doctors get into it just for the money.
I think that absolutely can happen. I think it's impossible to judge intention on a huge generality like that. But I think the war, just to answer your question, is that we want people to tell the truth about their supplement, about their pharmaceutical medication. In fact, there's been lawsuits that have been settled with the pharma industry in the 20 teens for $3 billion by GSK. Do you know what that lawsuit was about? What? Improper branding of the two medications, Paxil and Wellbutrin. These two medications were improperly branded.
I remember that.
And pharmaceutical companies were held liable.
Okay.
When do the supplement companies get held liable? When they say you'd be faster, stronger, better looking, whatever it is?
Pause. You've been voted out. I'm sorry.
Sorry. Thank you so much.
I had it too.
Back again.
Hello, sir. Good to see you.
Okay, so I want to point out something that you did.
I guarantee he sells supplements. I am confident he sells supplements. Let's go.
600 million to 2 trillion, correct? You stated that the 600 million was the size of the industry in the United States. You compared that to a global number.
The global number is 4 trillion. 2 trillion is the US number. If I said it wrong,
okay, all right. So I was just going to call you out of it. The other thing I would like to ask, though, is what is the...
Oh, what happened? Where's your energy? It's still 2 trillion. Where's the energy? Where's the energy, Mr. Big Guy? Oh, let me call you out. Let me fact check you right here. You got nothing to say about the price difference? Nothing to say at all? Nothing? Okay. All right. All right, buddy.
The operational definition, I'm assuming that that's coming from a research article.
Global Wellness Institute.
Okay, Global Wellness Institute. But what I'm asking you is, what is the operational definition? The reason why I'm asking that is because I would bet you dollars to donuts that when they came to defining what a wellness and supplement company is, they threw this wide sweeping net in.
Oh, yeah. So, yeah, this global organization that did this, they're corrupt. Like, obviously. They're corrupt and they didn't do their job right. So, but like us, even though we have no checks, even though nobody verifies all what we do, you should listen to us though.
Order to inflate the numbers, because when I did the research, it said that the supplement industry in the United States was 10% of what the pharmaceutical industry was.
That's accurate.
The other thing you just said it wasn't.
Because the wellness industry isn't just driven by supplements.
But your prompt was big supplement. So is it big wellness or big supplement?
Big supplement works in tangent with big supplement. Every time you see a wellness influencer, they're not just selling you supplements. They're selling you their courses. They're selling you their get well schemes, the miraculous fixes for whatever is ailing you. And this idea of capturing too many things all at once. When we say that their chronic diseases are significantly higher in children, I think you said that earlier. In the United States, kids are sicker than they used to be.
Oh, yeah, I said that. They're sicker. Yeah, absolutely.
Higher rates of chronic health diseases.
Yes.
Well, part of that is because there are more conditions that are now being counted in that scenario. And if you look at children's mortality, children actively dying per 100,000, it's actually significantly down over the last 30 years.
So who created the opioid epidemic, Big Pharma or Big Wellness? And how were they held accountable? Hundreds of thousands of people had died.
Agreed.
They had to give up $7 billion.
Agreed.
I spent 7 years of my life for...
So this guy, again, not fucking engaging with the conversation. He's just pivoting to his next point. This is why this guy's a bad faith piece of shit. I'll say this. I am interested in Mike's point, and I think he will say something that I would agree with. They deserve criticism, which is why they got sued, which is why they've done multiple payouts as of recently where they were paying millions to billions of dollars to people, to families. So yeah, let's criticize that. All right. Now, what about the influencers and supplements? Oh, no heat. Okay. Because, okay. All right, cool.
Peddling drugs.
Yeah.
My impact on people's lives was all compared to what they did.
See? Called it. He sells supplements. That's why he's so pissed. That's why he's so mad. It's like, oh, how dare you? How dare you call out my industry for selling supplements without any scientific backing? You're going to ruin my business.
And you're telling me that they were held accountable? That is absolutely utterly disgusting. So then my question is, just like what you asked this gentleman, if you're over here saying, hey, we need to light a fire, we need to hold Big Supplement accountable, then my question is, are you also investing equal energy in your own time to saying we need to hold Big Pharma accountable?
Absolutely.
In what way?
In every way. Anytime they say something that's inaccurate, I call balls and strikes.
With doctors too? With pharmaceutical
with
companies?
doctors, with pharmaceutical companies.
The crazy thing, because you're a disingenuous piece of shit, there's actually people who actually care about people. I know that's a tough concept because MAGA is not one of those people. They only care about their cult. That call out both sides. It's just you guys are so brainwashed. You think anytime someone's calling out your side, that just doesn't happen, but it does. The reality is your side is just terrible, which is why you get called out more often. I have an issue with Big Pharma too. I believe healthcare should be much more cheap. I believe our healthcare industry is fucked. So, but
you just called out the opioid thing that you said, what was their punishment? Well, you said
They
it's
gave up
$7
$7 billion.
I don't think that's enough. I think that there should be harsher punishments for those executives that were making those
Did you make
decisions.
YouTube videos
Of
about
course,
it?
we
You
talk
did?
about it all the
Okay.
time.
I don't know enough about your
But
YouTube
no,
channel.
no.
If you did,
go fuck you, yo. I hate this guy so much. He's so disingenuous, which is why he's asking all these questions. It's like, oh, I don't want your videos. Let me make all these accusations to you. Let me throw them out. I need to get you. Gotcha. It's not working. Oh well, I didn't know. Come on. I know we know exactly what your intention right now. You were trying so hard to call him out and be aggressive with him. And the moment you can't do it, you have to say, well, I don't know. I'm just trying to be a nice guy. I don't mean to. Like, come on. This is so fucking disingenuous.
It's not even about me. It's a bigger issue, but it's about trying to figure out what the truth is by calling balls and strikes fairly. So if we do something wrong in the healthcare industry, wrong, I will call it out. And medicine wants to call it out. There's definitely special interest groups. They need to be held accountable. But if you're going to do it sloppily, like how I believe Secretary Kennedy is doing it, you're actually going to have more bad actors. He likes transparency, right? He said he wanted to run on radical transparency. Can I tell you one thing that he did that's actually going to make things much less transparent?
Please do.
Every time HHS enacts a new policy since 1946, they had a period of waiting for public comment, for people who are stakeholders to talk about how this policy will impact them. Guess what Secretary Kennedy ended this year for the first time since 1946?
Do you know why he did it?
Yes.
Why?
I can quote you word for word why he did it.
Okay, so my understanding
No,
is
I'm going to read it to you. It's not needed, and it's not very effective.
Okay, but
this is his quote.
The reason why he said.
And now this motherfucker is about to defend RFK Jr. All right, let's hear it.
That is because the industries were using that process to actually interfere with things.
Wait, hold on a second. Public comment.
Oh, come on now. They can manipulate anything they want. The whole point of
Oh my God. Oh my God. These people are not real. They aren't real. Public comment, public scrutiny. So let's get rid of it. Let's get rid of public scrutiny. Like, come on, bro. How does this make it better? I thought you were against the big pharma industry. I thought you were against all these regulations. And now you're going to make it easier for them to do stuff without getting public scrutiny? Isn't that your whole thing? Oh, it's only your thing when it's like not MAGA. Only MAGA is allowed to do whatever they want and be authoritarian. Gotcha.
what he's doing in HHS is he's saying, here's how corporate capture is taking place, and here's how we get rid of it. That's all he's trying to do. If you look at what he did with like the FDA, he was saying things weren't centralized, they were ineffective, we don't need this much money, get rid of it. He's saying, here's how the revolving door happens, on and on and on, all these things. So even if you don't like Secretary Kennedy in and of itself, you do agree with some of the things that he's...
I don't even go as far as saying I don't like him.
Okay.
I just think that when you cut $3.8 billion from HIV, maternal health research, ALS, when you cut the funding for mRNA vaccines that in the future can perhaps help treat one of our family members from having pancreatic cancer, prevent them from having pancreatic cancer, I think that's not someone I want in charge of HHS.
Okay, but we just went over it. If everybody focuses on their lifestyle changes, we don't need that.
That's not true.
Yeah,
it is true.
Not everything in health is a
true.
lifestyle change issue. A lot of it is, but not
if your VO2 max is in the upper 2 percentile for your age group, your risk for all-cause mortality.
Yo, this guy, bro, he just thinks you work out, you be fine. You don't need diagnoses, you don't need medicine. Just work out, you'll be fine.
Is next to nothing. It literally doesn't matter. I'm not saying that they don't die, but they don't die from chronic disease is ultimately what it comes down to.
But do you believe in genetic diseases?
So genes have to be activated. The bad genes are activated by oxidative stress. Literally all disease is related to mitochondrial dysfunction. Okay.
Which Secretary Kennedy says he can diagnose by looking at people.
Which is why VO2 max is so powerful. You are judging the respiratory exchange ratio, which is telling you if your body is using.
I bet this guy sells some pill that corresponds with this VO2 max bullshit. I'm guessing he sells some type of supplement. These people do not care about you. Don't believe them. They just want to get rich off of you.
Fat for substrate, or if it's using sugar for substrate, you are then judging the lactate threshold. And if you use more fat for energy and your lactate threshold is further off, there is less oxidative stress in your body, which does not damage genes, which means that your likelihood for cancer and all-cause mortality is next to nothing.
But that's not true.
Lower cancer risk and better cancer outcomes, but is not protective in an absolute or guaranteed way. Like, we all know being more healthy, being more fit, we all know that can help you. Like, we all know this. It's not a one-fit-all program, and also not everybody can't stay extremely fit all the time. We don't live in the period of the hunter and gatherer where people are running all the time. That's just not happening.
It is true.
It's not true.
So then you're telling me that Dr. Attia is full of shit? Dr. Attia,
I don't think Dr. Attia would agree with you. I think he would say VO2 max, focusing on that, will decrease someone's likelihood of dying from heart disease. It will improve biomarkers.
He's literally said it. Your risk is next to nothing.
That's not true.
The whole point is that the current system that you are supporting, all right, quality of life goes up. We're in our 30s and our 40s, and it drastically starts to drop.
I don't think it should be that way.
Okay, it shouldn't be that way. It should just be flat, and then all of a sudden we should just go straight down.
Well, I don't think quality of life should ever just go flat. I mean,
no. I mean, like, so like my.
I actually think medicine. That's where it f***ed up. I think medicine does this thing
Dr.
where
Attia has talked about the chart where if you look at the difference that drugs have made, it's at the very end of life. It doesn't actually extend life.
A lot of times, yeah.
If anything, there's like this much of a gap as far as improving quality of life at the end. So if you're really looking at the research, the drugs have done absolutely nothing. And the other thing that it does.
The funny thing is he's quoting one guy. I bet if I looked into this, there's going to be a lot of research debunking, or at the very least, he's mischaracterizing the research. I mean, this is just commonplace. I'm not. This is where me and Dr. Mike differ. Like, we both understand certain health outcomes obviously make you healthier, but the need to find common ground is not useful in this conversation because this guy doesn't care about common ground. He is not willing to budge. It's very obvious he has an ulterior motive to sell his supplements, which is why he got so heated in the first place.
If you have sepsis and you are incredibly sick.
Acute versus chronic. When it comes to acutes, I will sit there and say, yes, we need doctors. Yes, we need pharmaceuticals. Sure. Okay. Sure. But when it comes to chronic
when someone's
disease,
born with type 1 diabetes, are you going to tell that person go VO2 max?
Why are they born with type 1 diabetes?
I don't know. But
you don't know?
You tell me why they're born.
Do you not maybe think that it's because the mother was unhealthy and there was oxidative stress that possibly.
It definitely raises the risk of it. But you don't think that people will need pharmaceuticals if they just think about their VO2
We
max?
have to make
Why
a
is
choice.
it an either or? Why can't it be both?
Okay, but here's the deal. We only have so much money, right?
Sure.
Do we have unlimited funds?
Well, we can separate it appropriately.
We need to make the decision. Are we going to continue to treat and enable, or are we going to prevent? Okay, if we start taking our money and we start putting it into prevention, things will change.
Bro, I'd be so curious. I would ask him, how the fuck are you gonna change these people's lifestyle? What the fuck are you going to do to change this lifestyle? Let me bet. Buy supplements. I'm guaranteed it's like, oh, buy my supplements and listen to my buy my workout program and buy my supplements and you'll live a healthier life. What if they don't? Well, fuck them. They can go die in the ditch. I literally think that is the extent of his plan. I really just do think that's the extension of his plan. Fuck you if you don't buy my supplements or buy my workout plan.
This will happen.
You know what helps with prevention? Vaccines. You know what Secretary Kennedy doesn't support? Vaccines.
Okay, pause.
And then he was talking about, well, vaccines don't work.
Claim is that Maha leadership cares less about health and more about money, power, and politics.
Hey, Doctor.
Hello.
How are you doing?
Nice to see you.
Good to meet you. So I want to hear what your proof for your claim is.
Yeah, so I think if you care about health, you would put investment into research into finding cures, as we talked about earlier. You look into systemic ways to get the biggest bang for your buck in terms of improving people's lives. I think the Maha movement has said a lot of those things to get PR wins, but hasn't actually executed any of them. Instead, what has happened is we've seen a tremendous cut in these budgets that have been reserved for improving our health.
Which, by the way, wasn't RFK who did that. That was the Department of Government Efficiency who did that. So that wasn't even him. They did that at the beginning of the year.
He's in charge of Health and Human Services, which is
Correct.
Responsible for NIH, FDA,
And Doge was in
and
charge
CDC.
of cutting all federal agencies, and they were the one who made the cuts. So, like,
I agree with you.
right.
Where
Right. He made that. They made those cuts in coordination with RFK Jr. I don't get. You think they did it without telling RFK? Like, what the fuck are you talking about?
was RFK on television talking about how terrible that is?
He wasn't anywhere because a large portion of that funding wasn't necessarily going to what we thought it was going to. For example,
Let's say yes.
Okay.
Let's say that's the case. You don't even need to prove it.
Okay.
Did he redirect that funding to something better?
No,
he
because
just cut it.
yeah, right.
But
because,
don't we need to invest more into
because
improving
I'll
people's
tell you
lives?
why. Because we have so many conflicts of interest in the government, which I think you would agree, right?
Sure.
Part of your claim, and I think you made this earlier, was that RFK actually is like he doesn't have to report where his funding comes from,
Sure.
which is not true because the head of the HHS, the CDC, the NIH, they all any head of any federal government agency always has to report any of their financial backings,
Okay.
right? So they do have to report that. But if you look at one of the things that people were very upset about, for example, how the NIAC board, right? You're familiar with that, where he cut
No, tell me about that.
so he cut I believe a lot of the members of the board there, and
Oh, the
everybody was-
ACIP,
that's what I meant.
Yeah.
Yeah.
the Advisory Committee for Immunization.
Exactly.
Practices.
Yeah. 70 to 80% of that board was not reporting enough of where their financial backing was coming from. So a lot of the backing
Wait, what are you saying?
that enough,
Immunization
exactly.
practices.
Yeah. 70 to 80% of that board was not reporting enough of where their financial backing was coming from.
He went from 70, 80, from 6% to 70 and 80. The USC Schaefer Center found that 6% of ACIP members had any disclosed conflicts of interest, not 70 to 80%. The study also showed that direct financial ties to vaccine manufacturers have been virtually eliminated, contradicting claims of widespread undisclosed backing. So he lives in a MAGA bubble. He's just making shit up. Understood.
So a lot of the backing that they're doing in those in that research isn't firstly necessarily going to where you think it's going. Well, what makes you think that they care so much about money, power, and politics when he's not making any money from it? He's clearly being demonized by the media, and they haven't even put any regulations in place. The only thing that RFK has done in the 8 months that he's been in office is the food dye regulation. Everything else has just been a recommendation. There's been no regulations that have been passed by the HHS.
Did you see the first Maha report that he put out?
I did not know. Oh, it was in September, right?
No, it was earlier in the year, but
Okay.
it was a big report. He said, look, we're trying to make children healthier. And there were
Right.
some valuable things. They were focusing on lifestyle changes. That's cool. 7 sources fully
Okay.
made up about research that was never done. When it reached out to the authors, that they listed their reasoning for why they were
There's no
making
way
certain
that's
recommendations. I guarantee you those sources were fully made up.
Okay.
People reached out to the participants.
The Make America Healthy Again report cited fake studies and contained inaccuracy summaries of the others. The White House admitted there were errors, but said it did not negate the substance. Other experts said the report should not be used for policymaking. Based.
names that were listed as authors, and they quote unquote said, we never did that research. It does not exist.
Okay, what was in the report? Because
The
I'll just be
report
honest,
is
I'm familiar.
dozens of pages long,
What was it about?
about children's
Did it
health
publish
care.
any regulation? Was it just regular?
No, the report was basically like a State of the Union report about what's happening with children's health. But
Got it.
isn't it frustrating or scary that the reasons why they're putting in certain recommendations in the report come from research that fully doesn't exist? And I'll tell you my theory about it, and I can't prove it.
Okay, go ahead.
That they used AI to make those sources, and AI hallucinated those sources, which I've seen happen when I ask AI questions.
Okay.
So to me, I think it's really scary.
Are you talking about the report that talked about like
It's the Maha
one-
landmark
one
report
in
that
30
they
children
celebrated.
have autism? Because that's true.
I'm not arguing about individual claims.
Well, let's talk about that for a second.
Sure. I think more kids than ever before have been diagnosed with autism.
Okay,
I agree.
Why is that? If so, let me just ask you this: do you think that
I'm
America
agreeing
is
to
the
them.
most unhealthy
They
nation
are
in the
not.
world?
They don't care
No.
about your agreement. They're hearing from
That's
narratives.
in the
Why?
world?
Yeah. We spend the most
Well,
on healthcare.
because
We're the
there's
most unhealthy.
countries
The
that
most
are-
highest rates
You
of
mean
chronic
from
disease.
in terms? You're comparing it probably to industrialized countries or like
Yes,
very wealthy
yes.
nations, but in the world,
We
I
have the
would
highest
say
rates
no.
of chronic disease. Would you say that?
Oh, I think we're up there. Look, who cares about absolutes?
Right.
We're up there. We're not doing great.
Okay.
Health-wise, we're terrible.
Okay.
In fact, a lot of the capitalistic stuff that got us so unhealthy, all this ultra-processed foods, we're now exporting to other countries and getting them sick, and they're catching up.
Yeah, and I think that that's a problem. Why are you opposing the first figure in 60 years who said that that's a problem?
Well,
So hold on.
I'll
Like-
answer your question.
Okay, go ahead.
This is good. Yeah, because I don't think he is. And I don't think he's actually doing anything to oppose it because he's sitting at Steak and Shake and telling people about McDonald's, how they used to fry their fries in
Right.
beef tallow, and it was so much better.
And
then answering your question even further,
Okay.
Michelle Obama tried to get kids to have healthy lunches at school. And again, not partisan here because Secretary Kennedy used to be a Democrat also.
Okay.
Michelle Obama had a program for kids to move
Didn't
after
those
school.
lunches have like seed oils in them? Because the whole point he went
Let
to
me just finish
the
the
fast
point.
food restaurant
Let me
because they
finish
removed
the
seed
point.
oils.
Let me finish the point. So whether or not there's seed oils or beef tallow, it doesn't matter. It's still junk food. Michelle Obama tried to get kids to have healthier lunches and she tried to get them to exercise. You know what people called her on the right? Food police. They hated it. They despised it.
I agree.
Michael Bloomberg in New York tried to put a soda tax
I'm
on
not
those
here defending the
giant
Republican
things.
Party.
But the issue is he's part of the Republican Party that's driving these
He's
issues.
part of an independent party.
But he's not. He's part of the administration.
Sorry, you've been voted out. Please return to your
Thank you
seat.
so much. Appreciate it.
This guy's a fucking brainwashed as fuck. Did anything? I think there was something interesting there in that conversation. It started to get railroaded, so they obviously got him out of there. I mean, this guy didn't know the report. The stuff about money. I mean, he's obviously getting power because he's literally got a position of power by capitulating to Donald Trump. So that 100% happened. Power is obvious. He's trying to utilize his influence to push certain programs without evidence. So that also coincides with power and politics. So the power and politics part is very clear. The money thing, I would have to look into it. I know for a fact that he was profiting off of like the anti-vax rhetoric that he was pushing. So he's definitely profited from that. Other than that, I would be curious to look into if he's kind of doing similar stuff that Trump's doing with his corrupt like money laundering schemes.
Hello. Nice to meet you.
Good to meet you, okay, this is something I personally know a little bit about because I joined the campaign to
cool.
see for myself if RFK was crazy.
Okay.
And
Did you think that initially?
No.
Oh.
I listened to some of his podcasts, read his like memoir on his family, and I was like, it sounds like this guy cares about people.
I actually would probably not disagree with that.
Yeah.
I mean, good intentions can have terrible outcomes, though.
Right. And I do have I was specifically like following his vice president, Nicole Shanahan, like around the country for 8 months. She had put together this think tank to figure out how to like fix climate change. Basically came back, said all green energy is bunk. There's one thing that we could do to become carbon neutral, and that's regenerative farming. But we'd have to switch over 200,000 acres, I think, of farmland. We either have to be able to explain why we're doing everything. Otherwise, we're going to end up in the situation that I think we are now. Tylenol, to me, was the antithesis of everything I had been trying to do. And whatever, I'm not there doing it, so like I don't represent them. But that was a disaster because we're here now fighting more instead of working together.
Do you think we're fighting?
Me and you?
Yeah.
No,
Oh.
but I do think that MAHA and the traditional medical world, there is a lot of misunderstanding and it's not good for anybody.
What is the misunderstanding?
Okay.
I mean-
all right. Actually, this guy might actually be a good faith. This might actually be a good conversation. Okay.
I think the skepticism with doctors that began with COVID. And I don't think RFK is in HHS without COVID. I think that there has been a disaster that has just kept going, and somehow we need to come together and make sense of this.
Well, I'm hoping today That could be it.
We're going to solve the whole thing.
Well, no,
right?
I think by having these conversations, we can.
Yes.
Because, look, okay, Secretary Kennedy got Skittles, I believe, to remove titanium dioxide, a random chemical outside of Skittles.
Yeah.
But, like, let's be as genuine and honest as possible today.
All right.
Is that the reason why Skittles is not considered a healthy food for kids?
Probably not.
So, like, I feel their administration is getting all these, like, random PR wins that aren't actually making America healthy.
Mhm.
And I would love for Americans to get healthy, but they're just not doing it. And they're distracting everyone with all of this noise that I feel actually harms people.
I mean, I don't entirely disagree. It feels, as someone who's trying to support this, it feels like there's sabotage in the administration.
Okay.
Straight up. I think the solution probably is, okay, HHS is cool for the first time ever, whether we like the guy that became the face of it or not. He's a 70-year-old healthy man who overcame heroin and
No, I think generally people really hate RFK right now, so I don't agree to that. But I'm gonna allow him. He's been good faith. He's been conversationalist. We're actually having a good conversation. I'm not gonna shade this guy.
talks to eagles. Like, that's not the worst thing we could be dealing with.
I think
But
Falcons are cool.
Yeah, but he needs help from the medical industry. He needs help from the pharmaceutical industry because it can't all be bad.
I agree.
I would argue
Because
that-
if someone fainted here today,
You're
we're all calling
helping-
911 or we're yelling
No,
for me to
you're
help.
helping
Yeah,
us.
that's the thing.
Yes.
I don't know if you saw during the GLP-1 press conference,
Yes.
there was an individual, this person fainted. Did you see what Secretary Kennedy did?
Makes no sense.
Well, tell me what he did.
He split out of the room as if.
What do you think I'm going to do if something was to happen to you right now?
Well, you took an oath. You have to help me.
Okay, so why is Secretary Kennedy the one going out and saying, I care about profit? Am I going to ask? Okay, I'll tell you even a cooler story that no one even really knows.
Yo, that's actually crazy. RFK, the guy who knows everything about health, fucking skedaddled. That's crazy. You know what? If I make this into a clip, I might have to pull that up and show the clip. Not gonna lie, that's hilarious.
I was on an airplane last week. I was flying across the Atlantic Ocean to France.
Yes.
I was exhausted. I didn't sleep the night before. The reason I didn't sleep the night before was because I was doing a Make-A-Wish in Disney with a child who was dying of a cancer, who's only buying time because of the miraculous work at one of the Texas medical institutions. After that, I flew back home only to fly the next day to France. I'm exhausted. They ask, is there a doctor on board? I'm exhausted, but I care about the patient more. I volunteer. I help one individual. There's a second medical emergency. I help the second individual. There's a third medical emergency. I help that individual. Do I need props for that? Do I need money for that? I couldn't care less. I want to help people. These are the type of people and there's so many of them. It's not me. This is who I work with. The people that I surrounded myself with, the colleagues. Do they fail at times? Do they make you feel gaslit as a patient? Yes. We suck at that because our system sets us up as doctors for failure. Healthcare spending is at an all-time high. Absolutely true. Is that because doctors are getting paid more? Absolutely not. It's because administrators have ballooned beyond any reasonable level. Pharmaceutical companies have no transparency. Pharmacy benefit managers who take kickbacks and all sorts of rebates with zero transparency break the system. And instead of going after those issues, Secretary Kennedy's calling me a profit monger. Aren't you mad at that?
Yes, I absolutely am, because I care about people. And I think that we should be doing a better job. And I think that a big part of what there's a hurt that our food systems have been ignored by large corporate power that does run things. And somehow this movement has come out of a place of people being like, there's important things like nutrition that needs picked up. Does it need to get taken over by pig supplements? God, no. We don't want more.
You've been voted out.
Thank you so much.
Yeah.
Oh my God, the only guy that was actually conversing in good faith. Of course they got him out of there. Of course they got him out of there. The conversation was getting good, but nah, they don't give a fuck about good conversation. Of course not. That's tough.
Hello, sir.
Good to talk to you.
Pleasure.
Yeah, going off of what the other guy said, you're saying that why is the RFK's industry, why is he attacking you personally, right, as a doctor? And I don't think he's ever called you out, Dr. Mike, what you're saying. I understand.
All
I'm done, bro. Ain't no fucking way he said that. Ain't no goddamn way He said that bullshit. Ain't no goddamn way he said that bullshit. No, we good. We good. All right. Let's go to the comment. I know he's a doctor, but he sure is patient. Hey, they cooked. That's a fact. He is a patient motherfucker. He is a patient motherfucker. Oh my goodness. He's so much better than me. He's a better person than me in every way. Shout out Jubilee.